Welcome to our World AIDS Day webinar. My name is Gloria Nalule McLaughlin. I do work for UNFPA as a HIV specialist. We are yet again here at World AIDS Day, a moment in time to remind us that AIDS is not over, but also to remind us of the journey we have come this far. It is 35 years later since the first World AIDS Day was commemorated, and it is a good moment, to remind us the progress we've made, but also to honor and remember the people that died from HIV-related deaths. Now, this year's theme is letting communities lead, as we very well know that communities are the backbone of the HIV response. So today we are here to discuss, to chat with you on the role of communities. And I am not going to be doing that by myself, but I am very happy to be joined by a group of young people that come from different communities, and they will later on introduce themselves. But with me, I'll be co-moderating this session with a young woman leader from Education Plus Initiative. And for those of you who do not know what Education Plus Initiative is, it is a high-level political advocacy that is centered around using education, secondary education, as an entry point for preventing HIV infections amongst adolescent girls and young women from sub-Saharan Africa. So in this session, we have one of the young women leaders from the Education Plus Young Women Leadership Hub that will be co-moderating this session with me. However, we do also have other partners that have joined us, have come in effort to make sure that this webinar happens with us. And this is Zivandiri, which is a civil society organization that is based in 11 countries in Africa. They do work to ensure health, happiness, and hope for children, adolescents, and young adults living with HIV through provision of different services that include capacity building for healthcare workers, advocacy, strengthening families and communities around HIV, among many other things. So Zivandiri is based in right now in Zimbabwe. That's where the head offices are. And it is also in time that Zimbabwe this year will be hosting the ICASA conference, which is happening in 3 days. So we have worked with Zivandiri to spotlight voices on the ground in the communities of Zimbabwe to show us where the HIV response is. So we'll be bringing in these voices in this webinar alongside the voices of our dear panelists that will be doing a deep dive on the role of communities, but also young people engagement in the HIV response. So we will right now go into Zimbabwe. We'll go all the way to Zimbabwe to see what they are doing in the HIV response. So we have a little video to share with you.
In the early days of the epidemic, the world faced a crisis that demanded unity, compassion, and innovation. Communities around the globe mobilized to raise awareness, challenge stigma, and advocate for the rights of those affected. Today, we stand proud of the strides we've made. Communities across the world have shown that they are ready, willing, and able to lead the way. Behind these advancements are dedicated individuals, healthcare professionals, activists, community members who have tirelessly worked to turn the tide on ending AIDS. Yet perhaps the most inspiring force in this movement is the strength and resilience of communities around the world. From urban centers to rural villages, people are coming together to make a difference. Communities like Zivandiri in Zimbabwe are breaking down barriers, dismantling stigma, and fostering environments where everyone is empowered to prevent themselves from HIV, know their status, and seek the care that they deserve.
It's actually nice that we involve the community members because they are part and parcel of the kind of challenges that people go through in our communities.
We can't change the community without including everyone.
Communities should be at the lead because this helps reduce stigma around HIV and AIDS.
It helps with reducing the rate of abuse.
It is the community that should take the lead to make a change initiative.
Community solidarity is very key.
Communities are powerful.
Community is the second family.
So what's important is let community lead.
Let the community lead.
Let communities lead.
Let community lead.
Indeed, we are letting the communities lead. We are letting the communities be front, center, and the back on this AIDS response. And this is also a reminder that, of course, the AIDS response has very many levels to it, but prevention is really key. If we can prevent, the new generation from getting in the cycle, that is the effort that we're going to try and work with, but also stand with the communities that are already living with HIV, that are accessing treatment, and encourage everybody, to go for testing to know what their status is. So the conversation around HIV is really broad. It is not just in one continent, Africa. Even if we brought the story from Zimbabwe, HIV is all over the world. It is in various communities, in key populations, in young people, in elderly people, in babies. So it is something that goes beyond just one aspect of life and one aspect of a geographical location. So our conversations in this panel discussion will give us a deep dive on what responses are happening all around the world. We have panelists joining us from the Caribbean. We have that coming in from the Philippines, from Mexico, from Africa. So it is a really comprehensive outlook on the HIV pandemic. So we will now go to the next session that I will hand over and introduce my co-moderator, Rejoice, to take us through the next session, which will be a panel discussion and listening to the amazing voices from community representatives on what it is that they are doing within their communities to advance the HIV response. So Rejoice, you are very welcome, and I will hand over to you. Rejoice, over.
Thank you so much, Gloria. And just to reiterate words from the video, as communities, we are ready and willing to lead the way in HIV response. Welcome once again to the World AIDS Day webinar organized by UNFPA in collaboration with Education Plus Young Women's Leadership Hub. And my name is Rejoice Namale, and I will be your co-moderator rather, for today, alongside Gloria. I hold a Master of Public Policy from the University of Oxford, and I am very passionate about education and adequate health services for all. I am also a member of the Education Plus Young Women's Leadership Hub, where we aim to accelerate efforts for HIV response, adequate education, and gender equality. Now, in this webinar, UNFPA has brought together young women leaders of the Education Plus initiative and also young people from partner organizations in order to emphasize the need to address the distinct challenges faced by different communities, and most of all, to show or exhibit successful community-driven initiatives and tactics in the fight against HIV and AIDS. Thus, I will now welcome our amazing panelists, or introduce our amazing panelists who have diverse experiences in the fight against HIV and AIDS. We have three panelists today. The first being Axel Batista. He serves at the Community Mobilization as the Community Mobilization Coordinator at Impact Global Action, and he has dedicated his career to the HIV field since 2016. His expertise spans various aspects, including human rights, healthcare accessibility, social communication, community building, partnership building, and political advocacy. Second panelist for today is Paul Kadibak, a public health professional from the Philippines with a Master of Science in Public Health from the Royal Tropical Institute in Amsterdam, the Netherlands. As the coordinator of the Generation Equality Youth Task Force and also the deputy chair of UNAIDS Global, he plays a pivotal role in amplifying diverse young voices and also leading initiatives for youth engagement in global gender equality and HIV response. Our third panelist for today is Kimberly Springer, and she is an advocate, an activist, and feminist coming from the vibrant shores of Trinidad and Tobago. She serves as a board member at the Global Network of Young People Living with HIV, and she is proudly representing the Caribbean region. Also, Kimberly contributes as a member of the UNFPA Youth Advisory Group of Trinidad and Tobago, where she passionately advocates for the diverse needs and issues faced by young women and adolescent girls. I will now bring you back to our webinar today. As I say, they have diverse experiences in the fight against HIV and AIDS and the power of community mobilization and participation. I'll start with you, Kimberly. How can we effectively strengthen collaboration and cooperation among diverse stakeholders and sectors. You know, we're talking about the communities, we're talking about NGOs, the government agencies, and also healthcare providers in order to enhance the collective effort in combating HIV and AIDS. Over to you, Kimberly.
Good morning, everyone. I hope you all can hear me well. Hope my audio is fine. So my name is Kimberly. I'm from Trinidad and Tobago, and one of the issues that we see in the Caribbean is where funding is concerned to foster collaborations and in order to let communities lead, to where capacity building is concerned for communities. So government agencies, NGOs, communities, healthcare workers need to collaborate more, work together to build capacity of everybody that's involved in this space, because we're seeing major gaps, especially in the Caribbean, where it comes to the HIV and AIDS response. Like now we are seeing that, oh, there's some issues, there's some things happening where communities, the organizations, only the grassroots organizations have been doing work for quite some time, and they have the relevant information that the governments or these funders and donors may need. But then there's this gap where, because of validating the data and the information these grassroots organizations have, it's hard for the organizations to access funding and do what it needs to do to continue advocating for the communities. So I really like the theme this year for World AIDS Day, when we say let communities lead, let us really let communities lead, because communities have been doing so much for the HIV and AIDS response since inception. And I'm really glad to see that communities are getting somewhat of a recognition now for everything that they have been doing and all the work they have been doing, because the communities are the backbone of the HIV response.
Thank you so much for that. I mean, funding is definitely extremely important for communities to achieve their goals. So thank you so much for sharing that, Kimberly. Over to you, Axel. How would you say community engagement and leadership have served as catalysts for positive change in HIV and AIDS prevention or education and support for initiatives?
Thank you, Rejoice, and thank you everyone for being in this panel with me. It's a really honor to share this conversation with all of you. I have some notes, so I'm gonna be just like guiding my conversation with the notes that I have. And you know, like, let's just start saying that since the beginning of this epidemic or this pandemic, the response to HIV has been always led and pushed by the communities. I mean, it's always been like that. We have been the ones who have been always like looking for new strategies about prevention, for new medications, pushing all those stakeholders and key people to really create the change. But behind that, it's always the community. And personally, me as a gay man, as part of the LGBTQ community, I think it has been always more important, and historically we have been always there. Because when this pandemic started, you know, when this pandemic was like the boom in mass media, we were the ones, the gay men, the trans women, the bisexual people, the LGBT community were the ones who were stigmatized and criminalized and blamed for this pandemic. But also we were the ones who were always claiming, we were always demanding and pushing the stakeholders, scientists, medical doctors, governments, basically, to really fund and to really give money for prevention strategies, for medication, for everyone. So yeah, like, since it's interesting, you asked me this question, and I like this because this is not something new. And this is not something that we are like, looking for. This is something that has been happening since the beginning of the pandemic, since the first deaths. And let me tell you something like about Mexico. Like in Mexico, for example, even though it's a country that we like to say, or the government likes to say that it's a developing country, and it's a really progressive country and blah, 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 because now we have like a left side or a left-wing government. In many practical things, when we talk about HIV and healthcare access, LGBTQ issues, and HIV education, sex education, we're still very behind compared to other countries. That's very crazy because these last 5 years, we face, as the community living with HIV, many medication, shortage of medication, many problems with the healthcare access, many problems with the criminalization of HIV, people who have been incarcerated because they live with the virus, people who have been persecuted because they live with the virus. And all of this in a society that has a lot of levels of homophobia, transphobia, lack of sex education, lack of HIV awareness. This really put us, the community, in a really vulnerable situation. But what is interesting is that also the community, the HIV positive community, have been the ones here in Mexico pushing an agenda that tries to change everything. And we have been a little bit successful in it. And it's not, I mean, if I say a little bit, it's not because we haven't done enough effort. It's because, you know, the system is really complicated to fight. But everything that has been changed in the last year positively regarding the HIV community and HIV pandemic has been always made by the community. One example, just to say something and just to close my participation. In the last year, but between the last year and this year, in Mexico, we have the first state that derogates a penal code, you know, a law that was criminalizing HIV, that was criminalizing the danger of contagion. It's very crazy that we are still those sort of laws in Mexico, where it was very beautiful and historic that thanks to the community in one really small town of Mexico, they really organize themselves. They really sit down with the stakeholders and with the politicians, and they change the policies. And that's an example how being in community, being together and fighting back together is the way we can change things.
Well stated. Thank you so much, Axel, for that. We need to definitely amplify the need for equitable healthcare for all, particularly in HIV response. Thank you so much for articulating that so well. You shared that there have been some success stories. You've shared that there have been some success stories. Would you mind sharing any best practices now that highlight the pivotal role of community-driven efforts?
Well, that was an example of how the community organized themselves in this small part of Mexico, in this small state in Mexico, to actually change the policies. And that policy is, I mean, for me, it's actually historic, and historic in Mexico, and I would say historic in all North America, because it's very crazy how states in the United States of America and in Canada, they're still criminalizing HIV and the danger of contagion, even like in Mexico, where it's very beautiful how it was a Mexican state that really changed everything. And it was like thanks to this community organization, you know. Another example, and this is also something that's very important to recognize, is that in Mexico we have also faced some cut of funds or cut funding cut. There is like the government stopped giving money to organizations and to communities to actually help in the HIV awareness, HIV education, and HIV prevention. They stopped giving money. So what we did with Impact, the organization that I'm working with, and another local organization in Mexico City, which is called Inspira, is to create these meetings, these convenings with people, especially with queer, gay, bisexual, positive, HIV positive people, to talk and to share experiences, to empower ourselves about our sexuality, our desires, our experiences, and to really create this sense of community and why being in a community, it's make us stronger and give us the really the energy and the tools and the knowledge to change, to sit down with politicians, with the stakeholders, and to change the narratives and the realities that we would like to change. So that has been a really good example, like just making the things, like gathering people, empowering people, giving them the tools, teaching them why it is important to be in a community and to work together, and telling them that you don't have to be afraid of the system. Yeah, the system is crazy, but you don't have to be afraid of it, because the system is not going to change if we don't really sit down and make something to change it. It's in our hands, not in nobody else.
Perfect. Thank you so much for that. I mean, you've ended it so well. Community organization is the bedrock for change, and it's up to us. And you know what? We're there to change the narrative in health. And I am here just commending you and all the panelists for the amazing work that you've been doing on the ground in your communities, in your countries, and beyond. It's definitely amazing work. And thank you so much for sharing those strategies. I think one thing that has been highlighted for both of you, the panelists that have just come on, both Kimberly and you, Axel, is the need for adequate funding. Community organization is great, but we also need to make sure that there's adequate funding to achieve our goals. Thank you so much, Axel.
Thank you.
Now, over to you, Paul. In the context of combating HIV and AIDS-related stigma and discrimination, how can community involvement effectively reshape attitudes of people, promoting empathy and also foster understanding amongst people?
Thank you, Rejoice. First and foremost, a warm greetings to everyone. Let me just start by saying, the last 40 years of HIV advocacy have been very difficult, most especially for someone like me or for someone like us, a young person, as it is not only surrounded by misconceptions or a lot of misinformation, a lot of systemic biases, but also a plethora of stigma and discrimination. I can see Rejoice nodding your head. But you know what? The last 40 years have been a story of heroes, a story of hope, a story of activism, and also ingenuity. So before I start answering your question and also giving those strategies on how to mitigate stigma and discrimination in my own community, let me just say a warm greetings and a warm wishes in today's World AIDS Day to everyone. So just to give you a little bit of background, so I am from the Philippines. So Philippines is a predominantly Catholic country. I think we are only two, besides East Timor, who's a predominantly Catholic country in Southeast Asia, and other countries surrounding us are predominantly Muslim. And we are among the top two in Asia and Pacific in terms of the number of cases, a high number of cases in terms of HIV. I think besides Bangladesh, we are recording around 400% increase, and our epidemic here is actually quite different in sub-Saharan Africa. So here, most of our cases are around young key affected populations, which are men who are having sex with men, transgender women, young key affected population ages 15 to 24. Compared to sub-Saharan Africa, which is more on a general population, if I'm not mistaken. So our approach is also a little bit different. And yes, we do have a lot of community-based approaches. So let me just give you 4 of our best practices here in the Philippines. So the first one is we really valued education at the grassroots level. Me as someone who's a young person, but also an advisor to a community-based organization who was really at the grassroots level, we are conducting population-specific webinars or learning group session. For example, we have community workshops for young MSM, and most of them are actually young professional, but also we are also inviting young MSM coming from schools and also universities. And I think we found that very effective, to really tailor educational campaigns to their specific needs and concerns. And that's what we have been doing in the last few years, no? And besides a specific education campaign for MSM, we also have a very transgender inclusive workshops, for transgender women and also transgender men. Like for example, we are also highlighting information on gender affirming hormonal therapy or gender affirming surgeries as well. So those type of needs and concerns, we also cater to that, And what else? We also have a very youth-centered peer education programs. And I will now come to my second point, linking our youth peer education programs. So our office here in the Philippines, most especially in the community, we also cater it as a working space / a community space for everyone. So we have a very small space in the middle of a city, and we invite different key affected populations to join in. Mostly they can do their assignments if they're students from school, or they can also use the facility to just hang out and just talk about the different issues and concerns. But also on the sidelines, we have the services. We have the HIV testing, we have STI testing. So it's not only a community space, but also a co-working space, but also the services are on the sides. So let me just highlight that. So we're having educational campaigns at the grassroots levels, and we also have community spaces. And my third point will revolve around community-led testing. So I think a lot of young key affected populations right now doesn't want to go to hospitals or clinics. And so that's why we also created something different. So we have this testing that is led by community and also for the community. And we usually bring it to our community spaces. So that's my third point. And then the last best practice that we're also doing in the last few months, actually we just piloted it this year, is a legal advocacy and rights protection program wherein we created this program called Equality Desk. So just to give you a context, probably in most of our countries here, we do have a women's desk in police station wherein they cater to specific human rights violations against women and also their children. So we actually tailor that particular program to our program, which is called Equality Desk. So it's a one-stop shop wherein we cater to the different issues and concerns of the key affected population of HIV, including LGBTQIA+ community. And we also link them to those organizations that provides legal protections and also redress mechanism. So those are just few of the best approaches that we're currently doing right now in the Philippines. And if you want to hear more of that, I'm happy to give more information. So back to you, Rejoice. Thank you.
Amazing. Thank you so much, Paul, for such an elaborate sharing or communication of, the best practices and the strategies that you have been using in your country and in your community. I mean, there's so much that all of us can learn from. You dissected about the misconceptions in health and the issues of stigma that we need to be able to deconstruct, and also you amplified the stories of heroes. We are heroes in our own right. We have come this far, and thus we are here to celebrate World AIDS Day as well. And thank you so much for again sharing your approaches, the value of education at the grassroots level, prioritizing participant needs, bringing together youth through youth-centered peer education programs, community level testing, and also something that I found extremely fascinating was your fourth one, which was advocacy and rights protection program. And the fact that you're offering or you're linking, women linking women or those affected to organizations that can be able to provide them with support. I feel like that is extremely, extremely commendable. And thank you so much for what you're doing in your country, Paul. Lovely. As we are here now, we are midpoint in our session. And so I will take a break, or we'll take a break, and then we'll all watch about more in the context of the voices coming from communities in Zimbabwe.
My name is Abraham Cecilia. I live in Old Tafara and I'm 18 years old.
My name is Aleta and I'm 19 years old. It was 2021, ndairwara. Pandakatestwa ndopa ndakaona kuti ndiri HIV positive. Zvakanetsa kugamuchira hangu ma-first days then ndobva tazosanganawo nemaketse ekuzvandiri.
What I know about the work of Zvandiri, inoshanda nevana vadiki vari below 24.
I am a CATS here at Zvandiri, a community adolescent treatment supporter.
I connect, counsel, and support children, adolescent young people living with HIV, and I link them to the services that they need.
We're supporting close to 36 facilities that are supporting children that are living with HIV. As Zvandiri, we're there to provide that support and to fill in those gaps in ensuring that children live a happy, positive life.
The community is very important, especially for us as adolescents, because we are more concerned about what the people around me are thinking because of my status.
Because community haisati yakunyatsoaccepta inoitenge zvinhu zvinonyadzisisa singaite kunge zvinhu zvisingaite kutenge it is the end of the road ndo zvinenge zvakuitenge ndo zvinenge zviri.
The community shapes us. The community gives us identity. We might be getting service from the facility or from organizations such as Zvandiri, but if you are not supported at home, it has a negative impact on us.
Community inofana tisupportawo vanhu vanenge vane status inenge yangu inini, because community kangotanga kungotiselecta kungoti isolate munhu anenge asatofile comfortable.
Sometimes tinombosvika pakuti give up, but only because of them tinokwanisa kuwana hope yekurarama and accepting as who we are.
Ini ndakabuda pachena anyari even chinotora matebulets angu nanditangure bhegi ndoya ndakabata muhoro.
Community inofana kutikoshesawo yotipo sika support, then I think zvinenge zvakanaka.
Sorry about that. Wow, that was definitely heartwarming and extremely important to hear. It is so important to address the stigma in our communities, especially the fact that the communities are shaping us and they're shaping our identity. And we need to definitely create a supportive culture for those living with HIV. And this brings me to my next question to all the panelists right now. And the question is supporting children living with HIV, focus on supporting children living with HIV. How can we advocate for governments to prioritize augmented resource allocations and financing opportunities for community-centered service provision? You know, what are the key challenges in achieving governmental support? And what strategies, in your experience, can be employed to overcome these hurdles? I think we can start with you, Kimberly.
So in the context of Trinidad and Tobago, what is something that is really important, because I advocate, and the organization I'm a part of, we advocate for the rights mainly of women and girls living with and affected by HIV. And because the conversation of key populations comes up, and for some reason, women and girls are often excluded from that key population aspect. When we look at the prevalence rate for new HIV infections outside sub-Saharan Africa, the Caribbean has the highest prevalence rate. So actually building the capacity of organizations, especially women-led organizations, or organizations that deal with women and girls living with HIV, building the capacity, taking time to invest in these organizations, especially in the context of the Caribbean and Trinidad and Tobago. Oftentimes, women are the backbone of society. They are the ones who are in charge of the household, in charge of taking care of the children, and like even outside the gender norm roles. Sometimes they are the ones who are working and bringing in income into the household. So actually, looking at building the capacities of these networks, and also looking at the age groups when it comes to young people living with HIV and new infections. From the ages 15 to 25, 15 to 29, we are seeing an upsurge in new HIV infections in this age group. So we need to pull back, and we need to say, like, what when it comes to for youth and HIV, what are we doing? Are we continue? What isn't working? What's not working? Are we going to continue pushing this abstinence narrative that everybody thinks when it comes to prevention? Pushing abstinence is always the answer. In some instances, when abstinence isn't the case, like young people are saying, we are here, we are having sex, we want the proper information, that we need to protect ourselves, we want to make testing, we want things that are easily available to us. So maybe removing some of the barriers it have when it comes to young people accessing treatment or testing where HIV is concerned. And I think we need to also look at, are we making spaces comfortable? Are we making health centers, hospitals, are we making these facilities youth-friendly, that youth would want to come to the clinic or to come seek treatment at the treatment sites? So even when it comes to adherence as well too with HIV, are we making the treatment facility youth-friendly? Are we doing the things that young people need, or are we just assuming, okay, this is what they need, this is what we think they need? Like fostering a safe space and a safe environment for young people, especially young people living with HIV and young women living with HIV, to feel comfortable to come and be at the table or sit at the table or say, like, these are our issues, where they are a bit hesitant or they're a bit frightened, especially to come seek, because they're like, okay, stigma and discrimination is alive and well in the Caribbean. It's alive and well and thriving, especially in Trinidad and Tobago. For some people, things may be a little better than some, but for the vast majority, that's not the case. Stigma and discrimination is alive and well. So are we fostering safe spaces or safe environments where young people could come get testing or receive treatment or ask questions when it comes to having sex, the sexual reproductive health and rights? Like, are we doing these things? Because in reality, young people are having conversations amongst themselves in their little friend groups or on social media, and are we seeing are we seeing things? Are we, especially stuff that they're saying on social media, it's a bit misleading. So I think where governments and ministries are concerned, like, take into consideration when they're doing their policies, when they're doing programs, take into consideration young people living with HIV, and take into consideration people living with HIV. Just don't have them there just to tick a box to say, okay, well, we had people there. Are we having the right young people there at the table when we're doing these different policies, when we're making these decisions as it pertains to young people? And then it goes all the way back to communities, because the community based organizations, the grassroots organizations would know who are these young people, what they would need, what they would want, because they have the information already. So to again tying that back into making that more available and more accessible and fostering that mentorship kind of program and that healthy relationship between NGOs and governments, because they seem to always have a little rift when it comes to aligning agendas and making sure that it aligns with what everybody's advocating for at the end of the day. Because at the end, we want to end AIDS by 2030, but are we working together as a team? All our priorities in order? We are essentially, we would think that we are all advocating and we are all pushing for the same thing. But so there's some things that needs to be ironed out where civil society and governmental organizations are concerned.
Awesome. Thank you so much, Kimberly. That was extremely, extremely important to amplify, building the capacity, making time to invest in women and girls living with HIV. That we understand the needs of our communities, segmenting them into groups, all of that, and understanding what is really happening, what are their needs exactly. They need adequate information. You mentioned that, there is a need for regular reflection and revision of policies. Removing barriers to access treatment is also extremely important. And one of the aspects that I loved about your statement as well was the need to make access to health comfortable, or spaces that are to do with health comfortable. Are you making spaces comfortable? These are the questions that we need to ask. These are the questions that policymakers need to be asking themselves. And again, the power of evidence-based programming and making sure that we have an aligned agenda are extremely important. Thank you so much, Kimberly, for highlighting all these also well. Paul, do you have any additions? What are the challenges in giving government support, and what strategies, in your opinion, would be able to overcome these hurdles? Over to you.
Thank you, Rejoice. First, I would like to re-echo what Kimberly said, that we need to make our health facilities adolescent friendly and also young people friendly. And I believe that in any advocacy, the power lies in its resonance to local communities. So what do I mean by that? We need to create a very compelling advocacy message in order for the government to really help us, and also for us to make them change their minds at the same time. So let me just give you probably around 2 or 3 strategies that we can use. So the first one is we really have to have a very compelling narrative. So what do I mean by that? We need to make sure that that each of our communities can actually take the lead, and we have to show it to them, in their faces. And then the second one is we need to highlight urgency. In most of the communities that we are serving, some of them, some of our political leaders are not really prioritizing, HIV or basically sexual reproductive health and rights. So how do we make them, change their mind? So we need to highlight urgency. So we need to give them the statistics, the numbers, how many young people are being infected, how many women, and also including their children, are also being affected by this epidemic. So we need to cater and also show them that this is the number, and we need to highlight that urgency. And then my last point is, I think I want to highlight what's really lacking among community-based organization is a training on how to negotiate resource allocation and also financing opportunities with our local government units. I think most of us are not trained on how to negotiate, on how to go beyond, those challenges and also those obstacles. And we're not thought of that. I mean, for me as a young person, I actually don't know how to talk to a minister or a politician or probably a mayor. I don't know how to persuade him. I think we need to have that skills. So, so let me just summarize it. We need to have a very compelling message, a very powerful one that is centered into and also resonated into the experiences of our own communities and also key affected population. The second one is highlighting the urgency of the need for funding and also financing. Then the third one is to really have that particular training on how to negotiate with these political leaders and also power. And also I want to end this. I want to end my message with a quote from one of my favorite person right now. She is a very strong woman who won the Miss Universe way back in 2018. I remember she said in her question and answer during that time, if we can just teach people how to be grateful, if we can just teach people how to be grateful, we could have an amazing world where negativity could not grow and foster, and children and young people would have a smile on their faces. Thank you. Back to you, Rejoice.
Thank you so much, Paul. I think maybe you can even be our trainee on compelling narratives because I'm already compelled with everything that you said. So yes, thank you so much for sharing that. We need to ensure that we share or let the community know that they're able to have compelling narratives to show the community the power that they have in order to change. That power lies with them. So thank you so much for sharing that. And also, I think you infused parts of what Kimberly has said. So great minds do think alike, evidence-based programming. Let us highlight the statistics in order to inform our policies. Let's support our policymakers. Let's make the case for our initiatives on the ground. And lastly, I really, really loved this part, how to negotiate financing opportunities with the local government. I feel like that is so, so important. And, we definitely need to take this up. And I just absolutely love your brilliant ideas, Paul. Thank you so much. Axel, any additions on this?
Yeah, thank you. Thank you, Rios. And I actually share everything that Paul and Kimberly just said about the importance of recognizing the needs of the communities and to give the space to the communities to take some leading roles in this advocacy, community advocacy. I would say that, I think what we really need is two things, to continue or to still pushing governments and stakeholders and companies, pharmaceutical companies, everyone, to recognize, but not only to recognize, but to really include in all their agendas, in all their actions related to HIV, the communities. We need to be there. Now, it's not only about just asking us. That's what I think. It's to really putting us there in the positions that really have the power to change. And when I mean positions, could be leading some projects, leading some activities, leading many things, because I think it's very easy for many governments or for many companies to say, okay, I just want to make this survey to just understand what the community needs and blah, 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 blah. But that's something, and it's very different when we are part of the planning, when we are part of the action, when we are part of everything that is being doing. So we need to be there. And also governments have to recognize all of this. Probably I'm insisting in this thing because what happened in Mexico is that with this new government that is almost we're right now in the ending of the moment of this government, but when it began 5 years ago, they got the funds to community organizations, and one of the justifications was that community was not doing anything, and that community was just just actually creating more problems for the government. And that's totally unfair, and that's fake. That's not true. What communities have, or what the history and the investigation, the studies have shown in the HIV advocacy history, is that communities are needed to actually reach people who really need, the people that we need to reach, you know, like Black women, gay people, trans people, sex workers, drug users. We cannot reach those communities without the help of the community. We really need to be there. So we really need to make the government understand that, and the stakeholders and everyone, so they can give money, and we need to see them. That's what I also say, that we need to be in those positions, not only asking them, but like be in that position to really have the control. And finally, as a member of the LGBT community, and this is my personal perspective, I think homophobia and transphobia are really in the roots of the HIV epidemic and the HIV epidemic, but also in how the government is reacting badly to the response of HIV. Because in countries where probably being gay or being trans is not a problem, still we have these cultural boundaries about homophobia and transphobia that don't let governments to give money because they think it's bad, you know, because they think it's for, you know, people that are like the worst of the society. And in countries where homophobia and transphobia are criminalized, like in many countries in Central America, in Africa, in the Middle East, in Asia, it's even worse, you know, because many people are being repressed about their sexuality and about their sex lives. And that is affected everyone, because we have now these bisexual men that they don't recognize bisexual, and they are having sex with their wives, or also they are having sex with their male partners or with their trans women partners or whatever. And they cannot actually be themselves because we are not recognizing that homophobia and transphobia are existing. Or we don't recognize that gays and bisexual and trans people are still there, are existing, you know? So I think one step that we need to move, or that we need to take to move forward in the response to HIV pandemic, is to recognize homophobia and transphobia as public health crisis, and to really understand if they are a crisis, then we have a bigger justification to really attend this pandemic, and to really provide more resources, and to really understand the roots of the pandemic. Because the roots of the pandemic is not that people is not taking care of themselves. That's false. That's actually putting the responsibility on us. The roots of the pandemic is that people are criminalizing, stigmatizing, and they just don't want to see what's happening in reality, and they just don't want to give money. So yeah, that's what I would say, to take communities in power positions, in really positions that really have a decision-making role. We really need to understand the power of communities in reaching other communities, the grassroots communities, and we really need to recognize transphobia and homophobia as public health crises.
Lovely. Thank you so much, Axel. That was well said. We should be part of the action planning in HIV response, and communities should definitely be at the center. They need to have the position and the platforms to amplify their needs in relevant fora. And also, I love the fact that you say that there's a need for communities to reach out to other communities in the quest for equitable healthcare. So thank you so much. At this point in time, we have reached the final part of our webinar today. I would like to thank all our guests for being such commendable and intellectual beings that shared their beautiful experiences. And you are with me, Rejoice Eve Namale. Thank you for allowing me to moderate. I will now hand it over to Gloria. Over to you, Gloria.
Thank you, our lovely panel. Powerful. That's all I can say. Those were really great insights and absolutely great points. The keyword, let communities lead. So at this point, allow me, because we are running short of time, to invite our global coordinator at UNFPA of HIV/AIDS, Elizabeth Benoma, to give us closing remarks and put a close to this webinar. So Elizabeth, over to you.
Thank you so much. And let me first really thank Gloria and Rejoice for the expert organization and moderation of today's session. And to our panelists, Kimberly, Axel, Paul, and Zvandiri in Zimbabwe, let me extend both really admiration and thanks for what you make happen every day on the ground. So today we're celebrating something that we have really known for a long time, that empowering communities and letting communities lead is a proven strategy to reach people who are at risk of HIV infection, to improve access to healthcare and reduce inequalities in service delivery and in life. The communities, you know yourself best. You know how to tailor the interventions. You know how to meet all of the needs where you are. And you have expressed really strongly today, you want to work with governments and healthcare workers and educators, the UN, and a multitude of partners, and be those communities that collectively bring us together in the strength of diversity so that we can actually bridge and close all of the gaps in the HIV response. I mean, the passion we've heard from you today are amazing. And I know that it is echoed in young people across the world. You as community leaders, you work to make the change. You give voice to the voiceless. You have helped reduce stigma. And you, as was said today, you have pointed us where we're doing well, our good practices, and where we're not doing so well, the bad practices that we need to change if we are going to accelerate and end HIV and AIDS by 2030. And you've done it overcoming really incredible obstacles. And you do this for a healthier, more equal, and better future for everyone. So across the globe as UNFPA, we see your power and your potential. You as communities are diverse, and you always step in to drive progress, and you have proven your resilience. I mean, as Kimberly noted, communities are the backbone of the response. Axel, you reminded us that you have always been there. You're the bedrock, and you overcome obstacles, and you claim and demand and push for change. You change the narrative. And in your last point, really remind us of some of these really root drivers of HIV that we need to address and we need to change. And Paul, the stories, the heroes, the hope, the activism, and how communities lead, bringing grassroots level information and services and rights literacy and protection. It's really, truly inspiring. And that last point that came from Zvandiri, that message that communities shape us, it is so true. So in short, I think communities are essential. We know that. We need to invest more in them. You provide a really magnificent return on investment. You are a force for change. And my plea to you is never stop. Thank you.
Well, thank you, Elizabeth. And allow me to end this webinar by thanking everybody. Thank you, Zvandiri, for coming on board to partner with us, to give us the voices and the images from Zimbabwe. For all our lovely panelists, thank you very much for these great insights. And for UNFPA, we remain committed to amplifying voices of young people in the HIV response. But before I leave, I would like to give a shout out, all young people, old people, anybody out there, to please protect yourselves. Don't compromise, condomize. it is important that we, we take care of our sexual health and well-being. So please go to our social media platforms, follow us on Twitter on The Condomize, go on Facebook, The Condomize campaign. We do talk about, it's a safe space for everybody to talk about the sexual health. We advocate for the use of condom, we root for the condom use, and we also share information, on STIs and unintended pregnancy prevention and everything around sexual health. So you can see our content, like, comment, and share. So until next time, please take good care of yourselves. Goodbye.